Okay, so welcome to Unlocking Excellence in Health Service Management, your path to success. And thank you, Luke, very much for your introduction. Moving straight on, just before I tell you a little bit about myself, in this session, really like to dive into the world of opportunity for health service management, of which I'm very passionate around the safety and quality area of that. So throughout this session, we're going to aim to provide an opportunity for insightful discussion. So please use the chat. Luke's going to be watching that, I hope, for me and interrupt me as required. And we're going to talk about the significance of education in health service management, as I say, focusing on safety and quality and how it can really fuel your career growth. So we'll be exploring why investigating in this field is a wise choice, and hopefully provide you with some essential information so you can go away, consider and thrive in an ever-evolving landscape in health and social care. So the other thing about this session is it isn't just about benefiting your career. It's about contributing to the enhancement of person-centered care and the efficiency and safety of our health and social care systems. So we're thrilled to have you with us this evening, and that you're considering your professional development journey and the success in health service management, of course, safety and quality. A little bit about myself. As Luke said, I qualified as a registered nurse, registered sick children's nurse as well, in the United Kingdom way back when, as you probably guessed. Not long after that, I had the opportunity to actually study to become a nurse practitioner. That's the Masters in Clinical Nursing. Because the nurse practitioner was so new in the UK, I was seconded to the US for a year of my study. So I was very lucky to see how the US health system was working as well. In 2004, we made a decision to move to Australia. I became in touch with the University of Tasmania and completed my PhD, my higher degree in research in digital health. Ostensibly, for those that are online, will be very aware of it if you're Australian, My Health Record. So I did my research in that, which then offered me the opportunity of working with the Australian Digital Health Agency and informing there on the person-centered care side of it. I now work on the Clinical Governance Committee, which is just under the executive layer in the leadership. I also work very closely with the Australian Commission for Safety and Quality in Healthcare. Of that, you probably won't be surprised because of what I'm talking about. The reason I've just explained my background in that detail is to really demonstrate somebody who started their career thinking they wanted to be a registered nurse, sick children's nurse, interested in one area, and through different pathways, personal and professional, I was offered opportunities to keep chopping and changing. And now, as you realize, I'm working with the University of Tasmania, very, very lucky to be able to offer the expertise and what I have learned over my career pathway to other people, not to replace in any way their career pathway, their knowledge, their skills, but actually bring them together. So when we're using the chat today, I really want you to chat amongst yourself, not just chat asking Luke and I questions, but chat amongst yourselves as well. So on to the next slide, which is a quick poll. And I just want you, don't take too long on the poll, which if I can see it, I will run it. Or can you see it, Luke? Oh, thank you very much. If you can just have a look at that, and right now, where do you consider yourself in healthcare, management, safety and quality? Well, that's fantastic.
Are you seeing that come through, Helen?
Yes, thank you very much indeed. So with that, great work, everybody. I can see a positive answer. 33% of you are considering you're absolutely sufficient for your role, but 69% of you, not unsurprisingly, are saying you would like to know a little bit more. So nearly 70% of the people here. So that's great, and it's also great to see that nobody has identified they want to stay unaware. So that's really good. Let me just share those results with you so you can see them. You should be able to see those, so you can see what I was saying about. Okay, guys, I've just stopped sharing that now for a moment while we continue. Okay, before I talk about the education side of health service management, we need to actually understand, firstly, a definition, and then think about, and it is we, not just Luke and I, what we need to consider in health service management in a very, very dynamic environment at the moment. So health service management typically involves overseeing, planning, coordination, and administration of health and care facilities and services. And it encompasses strategic management of support of resources, personnel, finances, and operations within health and social care organisations. And we need to make sure within that role we're ensuring efficient, safe delivery of quality care, adherence to regulatory standards, and the enhancement of overall healthcare and user well-being. So if I was to ask you the possible top two of the significance of effective health service management, could you pop what you believe the top two of effective health service management is in the chat? Just very quickly. Hopefully you can all see the chat. So what do you perceive as the top two most important effective health service management priorities? Great. Okay, so when I was preparing these slides to myself, that's great. I popped in the two headings at a strategic level about optimizing healthcare user or patient care. I think it's really important that we think about the efficient management, which ensures seamless operation of, healthcare facilities, which enables timely quality care for all. Yep, lovely. I can see those all running. Beautiful. The other thing that's already come up in that chat, thank you very much, is resource allocation. Effective management maximizes the utilization of resources for staffing equipment, enhancing health and social care delivery without unnecessary strain. Now you can see you've all got expertise in this area, and it's absolutely great to see those. And you can see all of you are slightly answering in different ways, which is a great way to network. Now, what is a health service manager's, again in the chat please, role for ensuring safe and quality care? Just the top three. What would you think are the key critical roles for ensuring safe quality care? No right or wrong answers here, guys. They'll all be right. Okay, again, when I was writing this from, again, that strategic level, that leadership level, I wrote risk mitigation, quality assurance, enhanced healthcare user experience. So the reason I wrote risk mitigation was proper management of practices, identifying and addressing the potential risks, reducing errors, ensuring the environment is safe, for the healthcare users and the healthcare professionals providers. When I say quality assurance, that's the management of the strategies that uphold standards, protocols, regulatory compliance, resulting in consistent and improved safe quality care. And when I wrote enhanced patient or healthcare user, I prefer healthcare user, but I even slip up myself, experience, well-managed services which contribute to a positive experience for the healthcare user, foster trust and satisfaction within the health and care systems. So for my mind, this is a very complex role as a health and or social care manager. So when we just say it or we just type in the chat, it's all very one-dimensional. All sounds easy, but you know, and I know there are challenges. So first of all, what I want to do is define the word challenge. And that refers to a difficulty or an obstacle that requires effort or skill or determination, resilience to overcome. However, it presents an opportunity for growth, problem solving and learning. By confronting complex and demanding situations, it grows us as a leader. So let's break the challenges down again. And if we look at complexities in managing health and social care services, one of the first ones I wrote here was the absolute dynamism of regulatory environment that we work in, these constantly evolving regulations and compliance of standards which create complexities by ensuring adherence and maintaining efficient operations. Resource constraints. So we say we need the resources, but we're constrained by them. Balancing quality care with limited resources, which we all know right now includes staffing, technology, financial allocations, and these all pose ongoing challenges. Please tell me if I'm wrong with what I'm saying. So some issues related to safety and quality assurance that I mentioned earlier and regulatory compliance. We've got healthcare user safety concerns front and foremost of our mind. We need to ensure our environment is safe amid diverse needs of the healthcare user, evolving clinical practices, which all need continuing vigilance and adaptation. And as a health service manager and leader, you're supposed to be able to juggle all these balls. Quality assurance struggles, consistently delivering high quality care while meeting standards and addressing variations in health and social care practices really demands us to present meticulous oversight, navigating compliance requirements. So we need to keep up with regulatory changes and aligning practices to meet the standards without compromising the care of the healthcare user. These are all ongoing challenges. However, we do have an educational journey and program that Luke has introduced to you in the introduction. And what you're seeing actually on the screen at the moment is the Queensland Strategic Framework for Workforce Planning. And it just shows, what I wanted to do here is show the complexities of actually delivering as a health service manager. So bringing together everything that I've just talked about. Now, when we develop the curriculums in education, we look at all these frameworks. We work with industry, as Lucas mentioned, and we go back to the industry these days to find out what is needed. So core curriculum, the foundation courses cover healthcare systems, cover management principles, and the ethics and the basic for understanding the field. We don't have the expertise in your particular area, but we do have the ability to access and bring together theories and practice. So I don't see myself as an academic. I see myself as a pracademic. So I really, in my team, encourage everybody to come to the table with their thoughts to improve health service management, and that's safety and quality. And again, as Luke mentioned, thinking about specialised courses and the advanced modules and focusing on safety and quality and improvement and risk management and all those complexities, but getting it right for yourself. So now the advanced practitioner pathway offers those choices to be able to align yourself to the professional development you require. The practical experiences actually come from where you're working. These courses are offered part-time online, as you know. So we can actually think about real-world projects in safety and quality whilst we're applying the theoretical knowledge. And this really empowers you for your future career. I suppose if I was asked what the unique feature was for the health service management, safety and quality, I'd actually have to say the diversity of the learners that are actually engaging in the course. We have from the Australian Defence Forces, correctional services, pharmacy, nursing, acute hospitals, morticians, dentists, all come online. And like you were just all joining in on the chat there to provide an example, the wealth of discussion that actually comes from yourself inspires me in the education we provide and hopefully inspires you as you progress through the course. We work in partnerships with industry. We don't work just as an educational provider. So it means a lot to us to be working with the industry when we're dealing with safety and quality. I've already mentioned the Australian Institute for Digital Health, the Australian Digital Health Agency, the Australian Commission for Safety and Quality in Healthcare. We work very closely with those industries, but also healthcare providers as well. So career development and support is there for you. We're a university, so that's there for you. That will help you make your choices, but there's this real progression as you go through. So yeah, lots of opportunity, I'm saying there. Now, you'll know the answer to this, I'm quite sure, because of the people that are online. But health service management is enormously diverse occupation to go into, just like nursing is. And perhaps I could ask everybody that feels comfortable to just type in the chat what sort of role they are in, and just sort of introduce. You don't have to introduce yourself as per se, but introduce actually what your role is. So it could be in a nursing role, it could be in an administration role, it could be in a consulting role. Just pop in the chat what you all are to just demonstrate that diversity we have here this evening. I've jotted down a few just while you're chatting. Brilliant. There we are. Here we go. Fantastic. Lovely. So the overarching that I jotted down in preparation for this evening was hospital administration, healthcare consulting, public health agencies, insurance companies. Are the demands growing? Absolutely they are. You know, there's opportunity for everybody here. The other big role that isn't on This screen for me is roles in health informatics, enormous roles in the whole health information management area. Whether it be in midwifery or nursing, I certainly know those areas. It's really big roles. So lots of growing demand in the area. Just for a moment and to have a little break, I want to just run a YouTube, very short YouTube video. And this is a little bit more specific. I just wonder if we can have a show of hands or thumbs up. Who's aware of Patch Adams and the movie about Patch Adams? Just thumbs up, whatever it might be. So this is going to be a poignant moment. The atmosphere reveals a real stark reality. Perfect, thanks, Rob. The instructor and the students approach this case as an academic exercise, and I really, really hope it doesn't happen today, instilling fear by delving into worst case scenarios in front of the person. There's an incredulous response to Patch's attempt to humanize her by asking her to her name, which actually speaks volumes. Yet this instance epitomizes what the character Patch Adams stood for. The essence of being a clinician transcends more than medical expertise, and that goes across health and care, I would say. So what this YouTube is going to do is going to encompass a profound ability to alleviate a racing mind and provide solace amongst distress. So just bear with me as you watch this, and then we will move into that whole safety and quality area, bearing this in mind.
Juvenile onset diabetic with poor circulation and diabetic neuropathy. As you can see, these are diabetic ulcers with lymphedema and evidence of gangrene. Questions?
Any osteomyelitis?
None apparent, although not definitive.
Treatment?
To stabilize the blood sugar, consider antibiotics, possibly amputation.
What's her name? I was just wondering the patient's name.
Marjorie.
Hi, Marjorie.
Hi. Yes, thank you. Here we have a
Oh, sorry. So just moving on. So as I say, that is a poignant moment. And the reason I've done that is to remind us all about who we're actually working for and working with, more importantly, in health and social care. So thank you for indulging me on that moment. But it's always a reminder to me that we're all potential health, well, we all are healthcare users at some times in our life, or will be healthcare users in our life, and like to think none of us are ever treated like that. So if I just now focus on safety and quality and the course that I'm embedded in at the moment, I want to just define safety and quality in health service management. It encapsulates the systematic and continuous efforts to ensure safety of the healthcare user well-being, minimize risk, and maintain high standards of care within healthcare facilities. So safety and quality, as Luke has mentioned, is delivered over 4 units: clinical governance, principles and models in practice, communication, and partnering with consumers. And the next slide will explain how we link that to the commission and industry. So in today's healthcare landscape, we need to be person-centered. We need to emphasize safety and quality, ensuring every person's, that's the workforce as well as the healthcare user, well-being and positive outcomes. Whilst doing that, we need to align with person-centered care models, and we try and do that. We work through risk mitigation models, addressing safety concerns, minimizing errors, reducing adverse events, and all those things you know about, which all enhances overall healthcare efficacy. And whilst we're doing that, we need to consider regulatory compliance, meeting quality standards and safety protocols, which are all essential. Just by way of a little anecdote here, when I first started on this course, and I had a very, very large number of learners in the course with me, one of the assessments asked the learners to actually provide evidence of all the standards, all the protocols for safety protocols that they came in touch with in one day of their life, in their working life. The enormous variety and diversity across Australia and the duplication of rewriting protocols for, I'm not sure what reason, because the Australian Commission has some wonderful resources, actually really takes a toll on the resources. So it's really worth just remembering that and reaching out to your neighbours, whether it's in state, whether it's across state or across jurisdiction. You should reach out to find out if somebody has written a framework or a policy before you ever think about starting off on a blank page. It really is worth the while, and obviously going to the Commission. So we need to really make sure we're working ethically and efficiently in this whole health and social care delivery. So the course highlights quality improvement strategies, healthcare user safety protocols, and regulatory compliance and the standards. How do we do that? We really engage with the Australian Commission for Safety and Quality, and each of these standards is unpicked, unpacked, and delivered to you in a way that is appropriate for your workplace, whoever you are, whatever your role is. I've told you about the diversity of learners we have in the courses. I should have, of course, said we also have consumers for healthcare in the course, because they're board members or CEOs or actually work at the Commission on the course. So it's everybody's role to deliver safety and quality in healthcare, and we make sure that the understanding is through the lens of the learner, not through the lens of the course. So if you ask me about the assessment pieces that you may see in such a course, we work on reflection and the skills on reflecting in our practice, whoever we are. We work on presentation skills, because these are skills we use in our everyday practice. And we do have case studies as a written piece, again, because we do have to write reports. We do quality improvement in health service management. So we actually really pride ourselves and evaluate very well with our learners from the point of view of the course and the graduate certificate we deliver. Finally, almost finally, I'm just going to put this up. I'm not going to put it up for too long, but I just wanted to share a testimonial with you. These testimonials come in all the time. What I wanted to show in this is not how much the person enjoyed the course, which they did, but how they actually developed as a person through the course. They started off very hesitant, trying to make connections, but through the course, they made those connections and they really grew as a person, and they're really doing an enormous amount of work in the safety and quality space now. So it's been, I know that's a really shockingly heavy slide, but it was really by showing the advancement of the people that join the course and that encouragement to become leaders that we really work hard to deliver. Now I've got this poll again for you. Perhaps Luke can run it again for you. I just want to ask you the same questions again, if Luke can, fine, thanks, Luke, to just sort of think about that question and where you sit now. That's really good. That's really good. And I can see that, there we are. There's the poll. I'm going to just share the results so you can see them yourself. It's almost break even. 40% sufficient in the role, 60% wanting new skills and knowledge. So I'm really pleased that this evening has actually shown you're doing really well in your job. So that's great. But hopefully, as Kathleen has popped in the chat, there's always opportunities to learn more. And that's sort of the way I look at life, that there's always this opportunity to learn more. There's always opportunities, and I love taking opportunities. I suppose I'm a half full person. So thank you for being involved in the polls. The other thing I have as well, just before we go to any questions and answers, is resources. These resources, the URL links are on here as well for you. You know, they're really good. I don't know whether you've seen them before, but I should really encourage you to look at those, and with your teams and yourself, just have a look at the competencies and see how you're mapping against them. And again, just test where your skills are. I certainly know from the Australian Digital Health Capability Framework and my skills. If you ask me to work in an intensive care unit now as a nurse, I'd have to say I'm not competent to. However, in a primary care setting, I'd be a little bit better. But if you ask me regarding the use of my health record, I'm probably right up there with those skills. So just take time to just look at those two capability frameworks and see whether you can work with them with your teams or, you know, even yourself there.